name is Gayatri Ram and I'm currently studying phlebotomy at the Qualitest Medical Laboratory under the supervision and guidance from Ms. Yuvit Ivering. What is phlebotomy? From the word phlebotomy, phlebo means vein, otomy means incision. Therefore, phlebotomy is defined as a procedure in which a needle is used to take blood from the vein. Functions of a phlebotomist. It includes a phlebotomist obtains blood samples from patients for medical analysis, research, donations, or transfusion. The equipment and supplies a phlebotomist will need on a specimen collection tray. We must have our requisition form. We have non-sterile gloves, tourniquets, adhesive band-aids or bandages, cotton wools or gauze, alcohol prep pads, a marking pen, syringes or transfer device, and your evacuated tubes or your blood collection tubes. Sites for venipuncture. There are three main sites for venipuncture, which is the median antecubital, the cephalic vein, and the basilic vein. The foot veins are last resort because of the higher risk of complications. Needle gauges. 18 gauge, which is used for donating blood or used for blood transfusion. The 21 gauge, this is used for routine blood draws or venipuncture. The 22 gauge is used for small or difficult veins, and the 32 gauge is mostly used as butterflies but also for more smaller or difficult veins. The components of an evacuated tube system. We have the needle within the stopper, the needle with the stopper, and the tube holder and the evacuated tube. You attach the needle device to the holder and you insert the needle into the vein. This here is the cap or the safety device of the needle. As you remove this, you insert the needle into the vein. You then engage the tube into the holder. Once penetrated by the needle, the tube will automatically fill with the correct amount of blood. The components of a syringe. We have the plunger, we have the barrel. This is a safety cover or cap of the needle. Removing the safety cover or cap of the needle, you have the needle and the hub. On the needle, there is a small hole, which is the bevel of the needle. Moving on to vacutainer tubes. There are different types of vacutainer tubes. We have the gray top. The gray top contains sodium chloride and it prevents the cell in the blood from utilizing the glucose, and this is used in the chemistry department. We have the red top. This does not contain any additives, and this is also used in the chemistry department. We have the lavender or the purple top. It contains EDTA and it acts as an anticoagulant, and this is used in the hematology department. The light blue top, it contains sodium citrate, which is an anticoagulant, and this is used in the coagulation department. The green top, this contains heparin, and this is an anticoagulant, and this is also being used in the chemistry department. The yellow top contains clot activator and serum gel separators, and this is used in various departments such as the serology department, the chemistry department, the chemistry department, and the immunology department. The order of draws. The order of draw for venipuncture. Blood culture, coagulation, glass non-additive tubes, which is the red top tube. We have the plastic clot activator tube, or the serum separator, for a short abbreviation, the SST. We have the PST, which is the plasma separator tubes, the lavender, then the lavender or purple tube, which has EDTA, and finally oxalate fluoride tubes, which is the gray top tube. Moving on to the order of draw for the capillary puncture. Blood gas specimens, CBGS, EDTA, other additive specimens, the PST, serum specimen, non-additives. Components of a phlebotomy tray. As mentioned, the components of a phlebotomy tray, we have gloves and glove liners, tourniquet, gauze pads, alcohol pads, bandages, tape, syringes, safety needles, evacuated tubes, pen, watch, antiseptics, syringe transfer device, butterfly collection sets, and most importantly, a sharp container or a hazard bag, a biohazard bag. The procedure for a hand venipuncture with a butterfly needle and ETS holder. First, you review the test request. You approach and identify the patient. Along with approaching and identify the patient, you prepare them for the draw or the sample collection. You verify the diet restriction and if the patient is allergic to latex gloves. You sanitize the hands, position patient, apply tourniquet, and ask patient to relax hands. You select the vein, release the tourniquet, and ask the patient to relax hands again. Clean the site and you let it air dry. You prepare the equipment and put on gloves. You fill, remove, and mix tubes in order of draw. Place the gauze and remove needle. Activate safety feature and apply pressure to the area of incision. You discard the collection unit. You label the tubes. You observe specimen handling instructions. Check the patient arm and apply bandages. Dispose of any used and contaminated material. Tang the patient. Remove gloves and sanitize hands. You then finally transport the specimen to the lab. For capillary puncture and veni stick and heel stick, this is the procedure. You once again review the test request, approach the patient and identify the patient using three forms of identification: date of birth, name. You verify the diet restriction or whether the patient is allergic to latex gloves. You sanitize the hands, put on gloves, position patient, select the puncture or the incision site. You warm the site if applicable. You clean and dry the site, prepare equipment, puncture the site, and discard the lancet. You wipe away the first drop of blood. Fill and mix tube in the order of draw. Place gauze and apply pressure. Label specimen and observe special handling instructions. You check the site and apply bandage. Dispose of used contaminated materials. And then once again you tang the patient, remove gloves and sanitize hands. Specimen is then being transported to the lab. Possible problem sites. Possible problem sites you will find with patients that is obese, that has damaged veins, or edema. Edema is caused by abnormal swelling by accumulation of fluid in tissues. Patients with burns, scars, and tattoos also can be a possible problem site for your venipuncture or sample collection. You must avoid these sites, veins, or because it's difficult to palpate or penetrate these areas. Patient complications and conditions. Some complications and conditions while doing a venipuncture sample collection from a patient is fainting, excessive bleeding, allergies to the equipment and supplies, nausea and vomiting, pain, and even seizures. The steps to follow if a patient starts to faint during a venipuncture. If a patient faints during a venipuncture, you immediately abort the procedure by gently removing the tourniquet and needle from the patient's arm. You apply gauze and pressure to the skin or the puncture site, and you call for assistance. You then document the incident according to the facility protocol. This has brought us to the end of my phlebotomy. Presentation. I hope my information was clear and accurate. Thank you for listening.